Woman in the yellow.
Don't legalize them.
Hi, my name is Susan Felter. I'm from Montlake Terrace. My husband have come up in here to speak today. Let freedom and life prevail without government. I would ask respectfully that you contemplate and study what has happened with Medicare, Romney Care in Massachusetts, and what goes on with the veterans' hospitals. There's a lot of wastage. I also disagree with hospice. Government does not have a right to play God.
Thanks. Let me get another hand up there and I'll answer the question. Rafika, turn right around, this gentleman with the beard and chewing, well, it's a school facility, better be chewing gum, but let me answer the question and I'll do that. With regards to Medicare, you know, a couple things about this particular bill and Medicare is that Section 202, for folks who like Medicare, and there are a lot of folks who like Medicare. Section 202, small letter D, number 2, uppercase C, says Medicare isn't going to be touched. We're not going to, if you're a senior, we're not touching your Medicare. You continue to use Medicare as your health care. Other parts of the bill that actually make some improvements to Medicare. For instance, the $80 billion that the agreement between the Obama administration and whatever, right? Between the Obama. On YouTube anyway tonight. I'm on it tonight anyway. The agreement between the Obama administration and the pharmaceutical industry for the $80 billion, that money is actually going to be used to start plugging the donut hole in Medicare on prescription drugs. So that's a good thing, I would think. It's a good thing. And then finally on Medicare, I spent a lot of time trying to get some changes to Medicare reimbursement rates, and we have an amendment or an agreement for an amendment. It's not yet in this bill or any other bill, and so obviously we want to work on that to get it in the bill, but it would finally change the Medicare formula so that our providers in this state will start getting rewarded for the high-value, low-cost care they're providing in Medicare, and start penalizing states like New York and Florida where it's high-cost and low-value care in Medicare. And so, you know, got to get the language in the bill, though, or in some bill still. So we're working on that. Okay, Rafika. Oh, by the way, I'm going to make a sign before I go. A note about signs. It's fine how they are. Be sure you understand that if people behind you, and if your signs are up, they may not want to see me. That's fine. They may want to see me talk, and you need to keep that in mind as you have signs. Thanks a lot. Yeah.
Yes, my name is Colin Hunter. I'm from Snohomish. And first I want to comment on your wonderful eyesight. I am chewing gum. Then I wonder if this is such a wonderful program, why don't all our politicians come on board with it?
Well, I can't hear Colin's question.
Okay. I've heard that there was a suggestion put up by a representative that be part of the program, and they voted it down. Why? If it's such a wonderful deal, why can't you join us?
Well, first off, I don't know that you'll be part of the public option if there's a public option. Hold on a second. There's going to be Rafika and Thomas. I don't know that you'll be part of it. I don't know your individual circumstances, so I don't know that you'll be part of it. But again, I'll go back to what I said earlier. If you like your plan and you like your provider, you don't have to change. You won't have to change the public option. The problem is I'm going to explain this and no one's going to hear it. and then I'm not going to be able to repeat it. So the public option would apply to folks who are in a healthcare exchange. The healthcare exchange is designed to create a market in insurance that currently doesn't exist for those who are insured, or those small businesses who are unable to insure their employees, small businesses, 20 employees or less, who are not able to provide coverage already. And those folks can buy insurance through the exchange. That exchange might include a public option. If the bill does include a public option, it certainly would include other private insurance plans who would be competing based on a basic benefit package. So there's some comparison within the exchange among plans that currently doesn't exist. So if you're in a group plan right now, like me, I'm a federal employee, I'm just in the federal employees plan. I don't have a congressional plan. I'm in the federal employees plan, along with other federal employees.
We want to.
And it works for me, and if you're in a plan and it works for you, you don't have to change. You don't have to change. So let's go down here, the woman in the maroon, and then we're going to move back over here.
We're going to drive all
in the maroon.
insurance out of business in 5 years.
Answer the question!
No, he didn't. Bunch of double talk.
We can have a debate about whether I answered the question or I didn't answer the question, or we can focus on the woman who I called on the maroon who's waiting for you all to let her ask her question.
Ask the question.
How do you want to do that? All right. I think they're for you. Go ahead.
Okay.
Yes.
My name is Gloria, and I'm in the financial field. So my question is, really, how is it going to be paid for? From an economist point of view, there's two ways the public pays for these things. One is increased taxes, and another is to depend on inflation. How is this really going to be paid for?
Great, and then while I'm answering that question, Thomas and Rafika make their way, over here. So you folks, get your hands up, get ready. Again, this is how the House bill is envisioned. We can't speak to the Senate versions of the bill. The way the House bill is written now is the cost of healthcare reform, according to the CBO, will be about $1 trillion over 10 years. About $100 billion per year. About half of that would be paid for through an additional 1.2% tax on incomes of people making over $1 million. I'm getting a huge shout out from the young guy up here. The other half, and the other half, and this is, folks may be a little nervous about this part, frankly, but the other half is from clear savings that you can get in Medicare from the very changes that we're trying to get in Medicare to force Medicare provision in other parts of the country to really do it like we do. And then you can take costs out of the Medicare system without impacting the care that seniors get, without impacting the treatment that seniors get, without impacting the ability of seniors to live healthy and healthier lives. So that's how we're doing that. And as we move forward in this debate, I think paying for the bill will continue. I think it's clear that paying for the bill, how we're going to pay for health care reform, will continue to be a part of that debate. And your input's going to be important on that.